how to manage back pain without medication. Are you tired of living on pain medications for your back? You're not alone, and you do have options. In this video, I'll walk you through proven ways to manage back pain without reaching for the bottle. These methods are backed by science, easy to start, and can make a real difference in how you feel. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon who believes that the best treatment plans start with the least invasive approach. Every day, I help patients take control of their pain without medications or surgery. If you want real strategies that empower your healing, subscribe now. Painkillers have their place, but long-term reliance can often lead to side effects, tolerance, or dependency. I always say that there is no medication that doesn't have side effects. The good news is that for many patients, back pain can be managed in other ways. Strategy number 1, daily movement and gentle exercise. I say that motion is lotion for the spine. Low-impact activities like walking, yoga, swimming can increase blood flow, loosen tight muscles, and improve mobility, all while reducing inflammation naturally. Even 10 to 15 minutes a day can add up fast. Strategy number 2, core strengthening and postural training. Strong core muscles are your spine's best friend. They act like a support belt. They are dynamic stabilizers of the spine. They offload pressure from your vertebra. Add in posture work, especially if you sit all day, and you may notice that your pain might begin to fade. Strategy number 3, stretching and myofascial release. Tight muscles and fascia can pull on your spine. Daily stretching, especially hamstrings, hip flexors, and lower back, combined with foam rolling or massage, can ease tension and bring relief without a single pill. Strategy number 4, heat and ice and contrast therapy. Old school remedies still work. Heat helps relax muscles and cold reduces inflammation. You can use them strategically. Patients will often ask me, what's better, heat or ice? And the reality is it's whatever works best for you. Just remember, never apply ice or heat directly to the skin. Strategy number 5, mind-body techniques. Chronic back pain isn't just physical. It can rewire the brain's pathways. Mindfulness, deep breathing, and cognitive behavioral therapy, or what's called CBT, can help you reset your nervous system and lower your pain intensity over time. CBT isn't going to cure your spine, but hopefully it will teach you to continue to do the things that you want to do in spite of the pain. I'm an orthopedic surgeon. My job is to restore function and keep you doing the things that you want to do. When to see a specialist. These techniques work best for mild to moderate pain, but if your symptoms are worsening or they're radiating down your arms or legs, or if they're interfering with your sleep or function, it might be time to see a professional. So to recap, you can manage back pain without medication by getting daily movement and exercise, strengthening your core and improving posture, stretching and releasing tight fascia, using heat and cold therapy, and tapping into the power of mind-body connection. If this video gave you hope or helped you think differently about your back pain, hit like and subscribe for more tools to take charge of your health. And drop a comment. What natural remedy has helped you most? Let's help build a community together.